Okay, so today I've got Jenna Mountain and Kimberly Galindo. Did I say that right,
You
Kimberly?
got it. Good
All
job.
right, perfect. And they are both LPC, um, licensed practicing counselors with Aspen House, and they are the co-owners of Aspen House. And I wanted to get them on really to continue the conversations I've been having with different practitioners that complement a lot of what I do as a physical therapist that works primarily with people that have persistent and chronic pain, and which a big part of that can be emotional. And so, thought who better to ask those kinds of questions to than a lady like you. So, I know Jenna a little bit more on the personal level in the past,
Yeah.
and just getting to meet Kimberly today. So, I'm going to let them tell you a little bit more about their training, their background. So, Jenna, do you want to go first?
Sure, sure. Actually, probably what we'll do is volley it back and forth. Kimberly and I
Great.
have very similar training, which is where sort of our professional relationship developed. But yes, Jason, it's so good to see you. It's been a minute. Our worlds personally kind of went separate directions, so I'm excited to be here.
Yeah.
Yes, so we are both licensed professional counselors in the state of Texas. We are both certified sex therapists, and so we actually specialize in sexual dysfunction. We're also both certified sex educators, and so one of the things we get to do when we're not behind closed doors and doing therapy for sexual issues is actually to go out and teach the community about healthy sexuality and kind of be on the proactive side of some of those things. We are both trauma therapists, which is a little bit of what you were alluding to earlier, Jason, and are trained in a form of therapy called EMDR, so eye movement desensitization and reprocessing. Which is, again, our preferred method of working with individuals who have had anything from traumatic experiences to adverse life events. We also get really creative with that as sex therapists and how we use EMDR with individuals with sexual dysfunction and kind of hurdling some of those challenges. Kimberly, anything you'd add, and then you want to talk about Aspen House a little bit?
Yeah, so within sex therapy and trauma therapy, we specialize in several different areas, not just specifically, but we do a lot of work with couples or individuals where there's been female sexual pain. Jen and I both work a lot with that issue. We also work with a lot of other sexual disorders and dysfunctions that show up in the sexual experience for folks. We also specialize in working with couples where one or both have been survivors of trauma. They've experienced some sort of traumatic event, which adversely, impacts their sex life, and helping them walk through the healing journey in that complexity of the individual parts of that and the couples parts of that. And so if you can't tell, Jen and I really have a passion for really complex, difficult human experiences. It's like
Mm-hmm.
very close to our heart, and we have a lot of passion for that. So we do those things together, but we do not do them alone. We co-own a practice in Richardson, Texas, called Aspen House Associates, and we have a team of collaborative therapists. We have a unique model where we're not just sharing a space together, but we share a table, we share cases together. And so where one clinician may be seeing the individual for trauma therapy, for example, and Jen and I may be seeing the couple to work on their
Mm-hmm.
sex life, or a variety of different ways to parcel out that complex human experience that is sometimes a puzzle. We have a play therapist, for example. We have a family therapist, we have grief specialists. And so we all collaborate together to help families deal with the complexities of the human experience, where it gets
Mm-hmm.
wounded and difficult, and love and enjoy and thrive stepping into that space with them and doing that collaborative work as a team.
Very good. So, one thing I wanted to ask each of you is how did you get to doing what you're doing? What led you to get into counseling, and specifically the areas that you are focusing on at this point?
Yeah. Um, so the nutshell version I actually started out studying engineering and architecture in undergrad. And much to my parents' disappointment at the time, I loved that stuff. I loved the math. I loved the science behind that. I loved the design aspect, and I just realized that I loved people more through a variety of experiences. Some of those in the church, some of those outside of the church, and so I switched to psychology after 2 years of dual degree work in the other. And so I have a 60-hour minor in architecture. So that's the fun part, because nothing transferred. I mean, just nothing transferred to that degree. And so, so that was the point when I realized I really wanted to work with people, and then got into my counseling degree. And it was in my counseling degree. Actually, I would say some of my interest in maybe sex education started when I was in undergrad, just realizing specifically in faith-based communities, I just was something I could not have articulated at the time, but I just knew something was missing. And so I think some of the interest started there, and how we were teaching our people about sexuality. And then when I got into my counseling degree, I found out there was this thing called a sex therapist. I really didn't know that before. And then it was like a dog with a bone. That is what I was going to do. And even had some, I think, mentors that were not as comfortable with sexuality, like, are you sure? And I was like, oh yes, like this is happening. and went into that. And then I always say that as far as trauma is concerned, trauma found me. As it does with many, many clinicians. And so I remember Kimberly sitting in class going, yeah, I want to work with trauma. And I remember going, I don't think that's what I want to do. Like, I don't know, that's not it. And then I got into my practicum work in grad school, and it was just trauma case after trauma case after trauma case. And I just fell in love with the people that I was working with. And so began also specializing in being able to serve them well. So that's sort of my, and then pursued all of the papers that have given me the ability to do that well. So that's my journey.
Yeah. And I think if I remember correctly, Jenna, when our worlds were together, I think you were still in the architecture. So you doing counseling was a news to me. Right?
Yeah. It's
when
been
you
a fun
up,
jump.
Yeah.
It's been a fun jump.
That's interesting. What about you, Kimberly? What led you to get to where you are?
Yeah. So just a love of humanity and wanting to understand the complexity of the human experience. So I originally started off as a music major for about a semester, realized I didn't like that because it was a life of solitude in a way that I didn't care for. And switched over to psychology, fell in love with it. And through undergrad and then post-undergrad experiences, began working in crisis centers, volunteering, even through employment and that kind of thing, doing interpersonal violence, domestic violence, sexual assault, sexual abuse work. And so really had a love for serving traumatic populations for a long time. And so my journey is a little bit reversed from Jenna's. I entered through the trauma door and had been working with and in trauma spaces for a long period of time. And as I sat in front of clients, I heard more and more that trauma has an impact on their body and their sexuality and their relationships and their intimacy. And I'm thinking, okay, so I have this missing piece, and discovered sex therapy and thought, oh gosh, these two things need to go together somehow. And so in grad school began to pursue classes and education in sex therapy. And then from there went on to get my certification in sex therapy, and have just enjoyed that journey of really complex conversations. Talking about trauma and sex therapy. We always kind of joke that we're fun at dinner parties when they're like, oh, you're a counselor. What do you specialize in? Trauma and sex therapy. And then there's typically various responses to those specialties, but just a drive and a desire to step into complex spaces, and not that we can solve them or completely make sense of them, but just to sit well with them. It really is something that I care a lot about.
That, or when you sit down next to somebody on a plane, either dinner parties or that. What do you do? Do you really want me to answer that question?
I think the plane might be worse, right? Because then
you're buckled
stuck.
in. Where can you
You're
go?
stuck. Yeah.
Yep.
It's either going to be a good plane ride or it's going to be really awkward, very quiet, maybe, right? Yeah. So this whole topic of just the emotional side of trauma, sexual trauma and non-sexual trauma is outside of my wheelhouse in a lot of ways. So I'm excited to be able to ask you guys some questions about this because, Kimberly, you mentioned, part of this being the missing piece. The sex therapy was the missing piece, I think is how you said it to some of the counseling that you do. And it reminded me of, oftentimes when I'm working with patients with chronic pain, persistent pain, complex situations, one of the phrases that I find myself using a lot is, oh, that's a piece of the puzzle. That's a piece of the puzzle. And so there's all these pieces of the puzzle. And as a physical therapist, I can address certain pieces, physicians and chiropractor, acupuncture, they all have their pieces. And so the emotional side, I think in a lot of ways often gets dropped for chronic patients and persistent patients. Although in the last, I'd say probably, at least from what I've seen, probably in the last 5 to 10 years, research is really starting to, I think, catch up as far as showing how emotional trauma can lead to chronic conditions. And correct me if I'm wrong, maybe even some of those chronic conditions being autoimmune related, and, especially childhood traumas. And I imagine the same with sexual trauma. So my first question to you ladies is, in the clients that you see that come in that have chronic conditions and persistent conditions, whether that's pain or whether that's not pain, what kinds of things or what factors are you seeing that seem to keep those cycles going?
It's in our offices, or at least I'll say in my office, it's a really complex, which when it feels negative, it's complicated, right? Conversation, because ethically, we kind of have to stay in our wheelhouse, and we're not medical doctors and we're not medical providers. We are watching something play out before our eyes that we're going, gosh, I'm so curious about that. So, we have to be careful about what we say, what we know causes it. But what we can say is we see really strong relationships with how people with a history of trauma, how it has wreaked havoc in a variety. I don't know if there's a pattern in my office or in what I see anecdotally as far as exactly what it causes. And that is just because I think, just this idea of epigenetics, like it's the play of both nature and nurture. We're all, walking into our life's experience with different genes that are just waiting to get woken up and fired off in a lot of ways. And so, but I do get really curious about some of those chronic conditions, I'll say, and how much trauma is at play. I think one of I get real confident that there was a big emotional component when I'm working with someone who has one of these challenges, whatever it is, and I'm doing specifically EMDR with it. And I'm biased. I love EMDR. I think it is just a brilliant approach to working with a variety of issues. And we are focused on a history of trauma. And as we are, the language in EMDR is reprocessing targets, and targets are basically like memories, emotional experiences. It can be a single one, or it can be kind of a bucket of ones that are all related that we call a cluster. And as they are reprocessing and going through the emotional healing work, when they're getting either to the end or even a little bit before, and all of a sudden they start reporting that those physical symptoms, or I am able to manage this autoimmune, disorder better. I would never say I wouldn't make the claim that we cured this, but I really do. I get very, very curious about how much was that emotional experience being maintained in your nervous system, at least contributing or maintaining this physical issue that you're battling. And so I don't know if we'll ever have the luxury of being able to thin slice it enough to say we know that this caused it. But we definitely see the anecdotal evidence that it is maintaining, contributing a significant amount inside my counseling room. So
Absolutely. And I think it's you can see it in the literature, especially in our field, where we've unfortunately just started going, what's going on in the body when there's been trauma? And I know anecdotally, I know research is starting to describe this, where there's traumatic events that happen and chronic conditions are showing up, and it's been such a mystery. And so again, to Jenna's point, I don't know if we'll ever have a formula, but I think there is definitely a relationship, which I think points to the complexity of the human experience and how trauma is stored. I think a lot of times the strategies and techniques in counseling and in psychology have been the mind, the emotions, and then we've kind of stopped there. And one of the reasons why I love EMDR, part of the protocol is, and where do you feel that in your body? And where's that showing up in your body? And tell me what your body's saying. And so I love that we're going to integrate, what Jenna and I would call a biopsychosocial approach, where it's this complex view of the human experience, which includes, hey, I wonder if your fibromyalgia or your vaginismus is connected to your trauma. And though I'm not here to create a formula, I'm not here to be your PT or your MD, but I do hold that in the space as I'm working with clients, because the body, to Bessel van der Kolk's title of his book, the body keeps the score. It's the scoreboard for what's happened. And so, yes, we see that on and on from, hey, I have just a headache when I think about this situation, to I've just chronically struggled with this physical condition my whole life. And so I don't think it takes me combing through hundreds of medical journals to see. I think these things are related and in relationship together.
Yes. Yeah, and listening to both of y'all answer that question, I think really confirmed in me why I wanted to specifically talk to you guys based off of what I was able to read from your website and what you specialize in, because one of the things you said, Kimberly, about EMDR, and I want to go back and let you guys define EMDR a little bit so people know, but one of the things you said was a part of EMDR is you have people close their eyes and go through that process, and where do they feel it in their body. And just to give you guys an idea of where my world collides with that, and I know we'll maybe get into this in a little bit, but I do a lot of body work, and especially visceral work. And with the visceral work, we talk about how our emotions, especially when they're overwhelming, or if the center of the brain that typically would deal with emotions is not functioning well, your emotions can be stored in specific organs. And in Eastern medicine, Chinese medicine, they designate certain organs with certain emotions. And so the other day, for example, I was treating a patient, and one of the things we were getting into was some things that seemed emotional. So we went through, okay, close your eyes, imagine something that makes you feel that anxiety, that emotion, and then where do you feel in that body? And then that can guide me to, okay, well, that may be dealing more with the vagus nerve, or that may be dealing more with the liver, or, and so it's really interesting to hear that. So I want to know more about EMDR. So would you guys tell me more about what EMDR is? What does it stand for? And then how is it used, and what's that process look like?
Kimberly, I'll let you give them the technical answer, and then I'll give them my fun word picture answer.
So EMDR stands for eye movement reprocessing and desensitization. It was developed by a brilliant woman named Francine Shapiro in the 80s, I think. And she had made the discovery connecting specifically eye movements to processing difficult content. It's one of the most well-researched trauma therapy modalities. And we're still trying to understand the mechanisms of the eye movements, or the bilateral movements, as we would now call them. But where we have kind of landed is a little bit like REM sleep. So when we're sleeping and we're in REM and our eyes are moving, we're digesting the day, we're reprocessing, and it's consolidating. And usually, that kind of goes well. But what trauma does is it disrupts that process. And so we have left and right hemispheres of the brain that do not communicate in the same way as they do when we're not in a crisis or trauma state. And so what happens is we are more in our limbic system, and we're reacting in that space because it has stopped communicating with the part of our brain that says, hey, that incident that happened to you at 17 is over. And so it's unresolved. And so what EMDR does is we pull up that memory at 17. We do some form of bilateral stimulation. Some of us do eye movements. We have since discovered that it doesn't have to be eye movements. And so some of us use, we have tools and resources like tappers that would buzz back and forth, stimulating both sides of the brain. Or tones that tick back and forth. So we pull up that content and we reprocess through it, allowing those hemispheres to talk and get to a place where connection is made and the brain goes, oh, I can turn off the fire alarms. The emergency's over. It's back then. I'm here now. And not only that, but the meaning that I have made for the last 10, 20, 50 years is not accurate. I'm not a failure, because a lot of times what happens with trauma is the meaning making. And so what I alluded to before is EMDR is complex. It's not just your thoughts. It's not just your emotions, it's your body. And so even when we're focusing on that target, we're asking all those questions. And so someone, when they've resolved a memory, leave going, oh, I don't feel that in my body as dysregulated as I did before. My emotions have reduced from a scale of 10 to 0. And that meaning that I have no control in the world and I don't have a voice and I don't matter, that's just not true. And so those brains have found truth, those sides of the brain have found truth and have regulated and healed in this really incredible way, which is what we were, I personally believe, created to experience. Trauma disrupts that and it gets it back into order and into congruence. And so it's really, really powerful and used for a lot of issues, but specifically for trauma and what happens inside of the brain.
Yeah. When I'm trying to help, because it just at first glance, and especially if you don't have any kind of brain or psychology background, it just kind of sounds like brain voodoo. And so when I'm describing it for my clients, I'll ask them if they've ever watched the movie Inside Out, which, surprisingly, a lot of the counselors and therapists of the world cheered that on. I think all of us were bracing or oh, are you going to do this well, Disney? And then we were like, oh, you did this so well. This is so great. But I asked them to think about, it's an early scene in the movie where Riley, the little girl, is going to bed for the first time. And throughout her daily experience, all those little globes are building up on the wall, right? And they're colored depending on what the emotional experience was. And as she's closing her eyes, you're inside the control center, hearing all the emotions talk to each other. And Joy goes, don't worry, I'll send them off to long-term memory. I'll do the thing. And she hits some button and they start whirling on the wall and ding, 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 and shooting out the back of the control center to the back of the brain to long-term memory. And what I tell my clients is when you go to bed at night, again, we're not super certain on what's causing what, but your brain was designed to have a bilateral process that helps you think about everything that happened that day, clean it out, decide what you need to keep for learning and future experiences, and file it away in a way that's helpful and you can access it again. And then you wake up in the morning. It's kind of like a computer that's been rebooted in a really helpful way. And I say, that's how it's supposed to work. That's how it was always supposed to work. That's how your brain was designed to work. And what happens is when we have a traumatic experience or prolonged extreme stress for too long, right? Which can have some of the same impact. your nervous system throws off the brain's ability to do that. And so it's almost like if you can imagine a train, like a toy train on a set of tracks, you just got knocked off. You're not rolling anymore. So you're stuck in that spot. And so what EMDR does, understanding the mechanisms of what's happening, is takes that little toy train, puts it back on the track. So we do all this process to set it up well. And then we start pushing it through with bilateral stimulation, because we know that that's how the brain reprocesses what it needs to do to heal. So we actually, the other beautiful part about EMDR is that we don't tell the clients what to do. We hold the structure, we set it up well clinically, but as far as like the meaning making and the emotional experiences and the processes, they are really in total control of where it goes. We know the brain will go where it needs to go in order to get to the other side of this experience. And so there's a real neat sense of ownership for clients in EMDR, because they know that was their healing storyline. And we are really, I cannot echo the words anymore. It's just what Kimberly said. We believe the brain was designed beautifully and able to do this. And so when we set up the mechanisms correctly, it can go there. It can find healing for these things. And just one more thing, just to add complete clarity to the cool thing about EMDR that I believe is really different than a lot of the other forms of therapy out there, psychotherapy, is we are looking at, we ask about images. So the visuals that go with the target, the emotional, like what feeling words to label the emotional experience. We ask about the cognitions or beliefs. And we ask where they feel it in the body. Along with like giving it an intensity level. And so what we do when we're working through the script to assess all of those each time and kind of set it up, we're lighting up the different parts of the brain so that the brain's going to access all of that. So we're not just healing the cognitions. We're not just healing the feelings. We're looking at everything as a human being and going, let's move it through. And so I personally see more healing done with the clients I've done EMDR with than the ones that I've done talk therapy with. It just can reach the far, corners of the brain and the body in a way that I just don't see the other forms of therapy doing as much.
That's really, really interesting. And I've got some follow-up questions for you. But when you mentioned talk therapy, is that what we would traditionally think of as therapy? You go into a therapist's office and you sit on the couch and you just kind of talk through things. That's talk therapy.
Yeah, I would say for me, when I use the word talk therapy, yes. And there is a variety of theoretical approaches that inform how therapists do that. And I'm a big fan of a lot of them. I've just found EMDR has a bigger long-term impact that's better for the client. So yeah, EMDR is a theory and modality.
How common is EMDR as far as being practiced in the counseling world? Is it, I know you mentioned it's the most well-researched, or it's very well-researched, but is it practiced often, or is it rare to find?
Rare would probably be too strong of a word.
Yeah.
Okay.
I don't know what the percentages are. It's growing in popularity. Part of why it is so well researched is because of the way it's structured. It used to be for years that CBT, cognitive behavioral therapy, kind of ruled the roost in evidence-based therapy, because the way that it is constructed can be measured. Whereas a lot of other forms of talk therapy you had a really hard time measuring them. So it's hard to say that they were evidence-based. Not impossible, but it was just harder. EMDR is so easily measured because we are scaling the beliefs and the level of disturbance and every single time we do a session. And so it's actually so easy to research. It's easy to show its effectiveness and do that. So I think that's a piece of why it's one of the best researched approaches. I don't know what you would add to that, Kimberly.
Yeah, I'm not sure on numbers as far as percentage of trauma therapists or therapists in general who would use EMDR. I know in the DFW area, we have a significant EMDR clinical community that use it for a variety of issues. And so I probably have a biased perspective because I, know a lot of therapists that use it, and we use it a lot in our office. But as far as usage and that kind of thing. I don't know if I've seen numbers on that. Yeah.
Okay, that's good to know. Jenna, when you were talking about EMDR, one of the things it made me question, and I want to get both of you, if y'all have thoughts on how sleep plays into this, because I know sleep, and especially getting into REM sleep, is a big part of where our brain heals. I imagine you guys are familiar with the lymphatic system and how the brain drains or gets rid of its waste, and we have to get into those deep cycles of sleep. So with emotional traumas, that's often interrupted. I'm assuming, is that correct?
So, yeah, it's one of the most common symptoms that shows up. I mean, I don't think, and no one hold me to this, but I've had a client yet that's come in with a trauma experience and said, I just sleep great. I sleep so great.
Right.
Sleep is so often disturbed in trauma and crisis. And I think we can probably all relate to that. You have something anxious happening the next day, you're in a crisis. I think about, just the climate and the experiences that we're in currently now with prolonged stress and with, a worldwide pandemic and all that has brought for us. And so sleep, yeah, it's huge. And I think it's not something that I think I've quite figured out how to conquer with clients, but I do everything I can to do some sort of sleep hygiene work with clients. I value it immensely because I know what it does to the body. And so even if we can increase it by an hour or just try to get quiet space or rest in some way, even if REM is not happening as often as we'd like, I'm just going to fight with them for it, even if we don't quite achieve it, because it's so important.
I'll add that I think that I add for many of my clients, as we progress through their EMDR treatment plan, and we are in fact reprocessing, which is kind of some of the middle phase. Their sleep experience does shift a lot. Sometimes it gets worse when we're in the middle of it, because we are actually asking the brain to access the disturbance more often when we're reprocessing. And although, we try to contain and zip it up and do all of these wonderful things to make it bearable as they're in this season of healing, as I like to call it. The reality is I have had people who have pretty okay, decent sleep, and it gets worse when they're in the middle of their trauma work. To some people sleep like a baby after an EMDR session. They're like, and there's just something about the day, the night of an EMDR session, I sleep so great. I have some people who say the opposite. And then I know as people sleep, for many of my clients, as that starts to get better, I'm not saying perfect and, resolved, but as it gets better with healing, because I do see generally that trend, I do think everything else, a little bit of a domino effect in a positive way, everything else can start to fall into place. I mean, their self-care improves, their ability to just do the healing work, to make choices from a place of rest versus exhaustion. So I do think it gets better with healing work. But yeah, no, it's wildly important. I mean, we're essentially saying we're mimicking what happens while you're asleep, like the really good parts of it to help you heal. So if we're not getting sleep, like we're impeding what I would at least say is growth that's supposed to be happening on a daily basis. As far as neural networks, connecting and solidifying and metabolizing and all that kind of stuff like that. If you don't sleep, that starts to fall off.
Yeah, that makes perfect sense. So somebody that has a history of emotional trauma that they're aware of, right? Because I imagine a lot of people aren't even aware of how it's affecting them. But for somebody that has become aware of it, and not just emotional, y'all are both experts in sexual trauma as well. So somebody that's aware of that in their history, what suggestions do you have for them? Is there anything that they should be doing to help themselves? Should they seek out somebody like yourselves right away? What suggestions do you have, somebody that might be watching this thinking that sounds like me?
I'm going to add something before we'll say Kimberly brilliantly answers your question. What I often find is that trauma sneaks up and bites most people. Some people go, I have a trauma history, I can clearly name that and whatnot. But what I guess we don't talk about enough is that many people who have had emotional trauma are unaware that they have had it, and that they've had an experience that would qualify as a trauma. Maybe not according to the diagnostic manual, but at least according to their nervous system. I mean, I always say that, like, well, maybe it doesn't hit the diagnostic criteria, but your nervous system acts like you've had a trauma, and that's what we care about, is how you're experiencing life and quality or lack thereof. And so, for a variety of reasons, we either don't pay attention to our body, or what we can take a step back and clinically or professionally, or someone with a different experience can look at and go, gosh, that's traumatic. That was their normal sometimes. And so they're going, what do you mean traumatic? Like, this is how life is for everybody, right? And so there is a great number of people who would qualify, at least from a nervous system perspective, as having a history of trauma, chronic, complex, single incident, whatever it is, and don't know, don't even know. It's not that they're not choosing, they just don't even know that is a reality in their bodies and their stories. And so by the time most people find us, I would say they are in the throes of trauma reactions and symptoms, because whatever creative, and I'm going to say wonderful, survival and coping mechanisms they didn't even know they were coming up with at the time to survive the experience, it has run out of gas. I tell all my clients, coping and survival techniques all have an expiration date. They are not meant to last your whole life. And so typically by the time people find us, they're like, I can't, they feel like they're not surviving well, because they're not anymore, but they've been in survival mode for too long. So I just think it's important to note that as we talk about people coming, people who are aware of having trauma. I think the part of our challenge is most people are not aware that there is something worthy of working on, and that this is not normal.
And then I think, to your question, I think when they become aware, I think some of the first steps are, yes, I mean, I would highly encourage counseling. I, obviously have a bent and a bias for
bias.
Right.
Kind of foolish for me not to recommend that. But I would say a trauma-informed therapist, because not all therapists are informed in trauma in the way that they really need to be. I personally think every therapist should have a little bit of a lens, enough to know when to refer, at least. Just because I have seen the havoc that it wreaks on clients when folks don't know what they're doing. And I think
the reality is that's not true.
Right. Yeah. And so I think how is you need to hear the truth. And that's trauma therapy takes a long time to heal. It's a long process. Trauma is such a long experience, so stored in the body, that pulling back all those layers takes time. And so if you hear a quick fix, I would walk away pretty quickly. I would want to hear a therapist articulate, mind, body, emotion, relational types of healing. I would want to hear a therapist talk about, things that don't force trust between the client and client and therapist, because trauma shatters trust relationally for a lot of clients. And so I don't expect a client to walk in and just hand me everything vulnerably with all trust. And there's no expectation of that. There's no even need for that. And so I think when it's sometimes I've heard clinicians, talk about clients being resistant and those sorts of things. And it's like, no, it just, again, what's happened to them is shattered trust. And it is a coping and self-care and safety mechanism that kept them alive and well. And it takes time to learn how to heal and trust again. And so finding a trauma-informed therapist, I think a lot is coming out in the literature and research over the last decade or more about doing things in your body. And you know this well, Jason, just like yoga, finding a kind of thoughtful, slower yoga practice that is, doesn't even have to be, because there are practices that are trauma informed yoga. Those are harder to find, but just something where we're not doing power yoga. We're not there to just stand on our head and for a long time, but just an intentional practice. It gets us into our body and it's very regulating. I think there's a lot of doing mindfulness and or hypnosis or those sorts of things that really get into learning to regulate what has been so dysregulated. Sometimes it's helpful to have a therapist that walks you through, here's some thoughts and tools and resources. But I think I have found that clients who have a regular kind of body practice, whether that's yoga or just mindfully walking every day or some sort of way of kind of closing out their stress cycles, that's really, really helpful. But yeah, I think I would say start with therapy and start with trauma-informed therapy, because our brains are going to all of that spaces. Where's their body? Where's their relationship? Where's the trauma history, and thinking through that complexly.
Yeah. And I love what you said, that, being truthful about trauma, that it takes a long time to heal. And I can relate to that in my world, in that a lot of the patients that I see, I end up seeing them a lot longer. And a lot of that's probably because of what they've been through over time. And I think as, at least as a Western culture, we have lost the ability to suffer. Right. And to know what that means. And we want that quick fix, because there are so many, what seems like quick fixes out there. And so I appreciate you saying that. And I think a lot of people are going to appreciate hearing that as well. Because it is good to know going in, like, this is a journey. This is not you're going to be healed in 2 or 3 visits, or, next week you're going to be feeling much, much better.
Yeah.
So I appreciate
it's
that.
Nice for me to hear that there's a physical therapist in the world that's making that same statement, because I'll be really honest, as trauma therapists, we get compared to the Western medicine model a lot. And we give clients that are very, very frustrated with the fact that, what do you mean years, and like, they've never had any other professional tell them that. And I'm like, well, that, and again, that's being ethical, and that's being honest, and that's holding space for that. But I do sometimes feel like the Lone Ranger in that, because so many other practices will be like, like 10 to 12 visits, or this is exactly the protocol for this. And there's just nothing about trauma that fits the short-term or overly protocoled model. It's just not. We just have to have confidence in the healing process, but hold it very open-handedly.
Yeah, absolutely. And in my world, a lot of the times, these are patients that have been told by multiple types of practitioners, either, you've met your goals, or I've done everything I can for you, or this X-ray or this MRI or this test doesn't show what you're telling me, so I can't help you. And it's frustrating. I imagine y'all get the same thing when you have patients or clients that are coming in like that. So yes, likewise, it's good to hear, because I know that in the counseling world, there's probably varying different styles and focuses. And so it's good to know that. And I think clients need to know that, because just as in the PT world, it makes a difference which PT you end up with and what their focus is and how are they going to be able to help you. I imagine it's the same in the counseling world of, you can't just go to, Kimberly, like you said, like, a non-trauma informed therapist and expect, trauma treatment or trauma to be addressed as well. So I appreciate hearing that as well.
Absolutely. There are appropriate times for brief therapy. Trauma is not one of them.
Yeah. Well, so as we start to wrap this up, I wanted to give you ladies a chance to tell us more about Aspen House and some of the other services that you offer, some of the other programs that you might have, and then just anything else, any other topics that you would like to talk about or you would like people to know about you.
Yeah. I think there's a lot of really wonderful therapists in the world. We're very biased to our team. We tell people we would not have hired them if we wouldn't trust them with our families. So we have a very, very talented team of clinicians. And part of what we do, like Kimberly said earlier, is specializing in a collaborative model where there are multiple therapists with their hands in the bucket of a case, and really working together as a team in order to really address what the challenge is for whatever it is, individual, the couple, the family. And so everyone at Aspen House is trauma informed. Everyone at Aspen House is trained in EMDR. And then from there, we all niche out. And so, we've got a gal who just wrapped up 2 years of work specializing in grief and death studies. And so she is a grief specialist. So if you've talked about something really complicated in life, the embracing of suffering on this side of eternity, she is a masterful clinician when it comes to grief. We've got a gal who specializes with the babies, she works with the kiddos, and she is EMDR trained too. And so she does EMDR with the kids. She knows how to do that. She knows how to weave between play therapy, which is the appropriate language for kids, and EMDR. And she knows how to kind of ebb and flow between those to attend to what's coming up for these kids. Very developmentally informed in her work across a lifespan, because she also works with adult and adolescents. Have some very highly trained attachment oriented therapists. We've got the family therapists who are like, get everybody in the room. Yeah. And we love them for that. Everybody plays their role. And then there's, Kimberly and I are the only certified sex therapists at the moment, but we've got a handful almost that are in the process, because we know sexuality is showing up in every single complaint. And so, we are, it moves all the time, but we are essentially full. And so we have wait lists. And so we looked at our team and we said, hey, anybody else want to do some sex therapy? And so they're all in training because we get a lot of calls for that. Outside of that, we have some exciting things that are coming in the future. We are definitely, we are getting ready to launch a podcast. Kimberly and I are kind of moving into some adjacent areas, professional projects. One of them is a podcast. And so we're excited about that. That'll launch early next year. We're also getting ready to move into the community-oriented online education world. We have done a soft launch this year. Our play therapist put out an incredible, like a little mini course for parents on how to work with their kids' emotions. And Kimberly and I are in the middle of designing courses in our area of expertise, which is trauma and sexual dysfunction, to help equip more people to make that information. There's a large part of being a sex therapist that is psychoed. And so we are creating courses for that. And then we'll be moving here in the next year or so into doing some leadership coaching, which we're really excited about. So yeah, we're kind of moving into some new spaces as Aspen House and beyond. What would you add, Kimberly? I know I sound like Buzz Lightyear when I said that. And beyond. I have a son, so what can I say?
Yeah.
I think that captures it. We also do some groups, depending on kind of the need of the community at the time. We have a trauma group going right now. At the beginning of the year, we had a lot of groups in response to COVID, first responders. And so we're really always trying to listen to kind of what's happening in the community and what the needs are to respond to that and offer services to them. And so we also do some group work, which we love a lot, and giving back in that way as well. But yeah, no, lots of exciting things going on now and in the future.
And we are both in the office. And, one of the things that the pandemic has sort of pushed us into, and we have fully embraced, and I think really owned and mastered, is we do everything but play therapy online. Okay. So we can offer EMDR, sex therapy, all the things. If it's appropriate for the client, we can offer it online. So our jurisdiction is really the whole state of Texas. So
Awesome.
we've embraced that, and we are serving people all over the place.
Yeah, and that's good to know, because you guys are in Richardson and I'm in Fort Worth,
Mm-hmm.
which that alone would be a big drive. So,
Yeah.
if somebody in Houston happens to watch this and says, I really want somebody like that, then that's good to know they have that option.
Absolutely.
So where can people learn more about Aspen House?
Yeah. So we will send you our website if you want to post that anywhere, but it is just aspenhouseassociates.com. So that's ASPEN. And it is, we like to be a little bit edgy. So house is spelled like the nice little German way, HAUS, associates.com. And you can find everything from there. And then Kimberly and I are getting ready to launch the other things, but you'll be able to link to them from that website.
Perfect. And I'll definitely be putting that contact information on the R3 Physio website, so that way people can get access to that way. And then are you guys on social media?
We are Aspen House Associates on Instagram and on Facebook. Again, I can send you those links so it's easy for people to find. Yeah, all the places.
Okay, very good. Well, I appreciate this. Like I said, especially this interview was outside of my wheelhouse in a lot of ways. And so I've actually learned quite a bit. And I think I want to know more about EMDR. So I may be asking some more questions of you guys at some point. But
yeah,
I appreciate your time.
Absolutely. Thank you, Jason.
Yeah, you bet.